Okay, good afternoon. My name is Jason Fries, and I'm a paramedic by training and the founder of Trek Medics International. We're a nonprofit organization that builds 911 systems in countries that don't have them. Today I'm joined with Yong Lee, the CEO of Vision Point Systems, who has been working with us, Trek Medics, for about 7 years now, and joined me on a trip to Malawi, which we're going to share with you a little bit about now. So, just to give you a little background, table of contents here, what we're going to go through very quickly is the background, the system design, how we set this up, the constraints that were put on it, the challenges that we faced in developing this, and also where things, the outcomes that we got to and where they are now. So to give you some context, the Republic of Malawi is a country in southern Africa, about a third the size of California, and with a population of about 16 million, 18.5 million. And it's actually quite an impoverished country, definitely qualifies as a low-income country. Former British colony, gained their independence in 1964. And they've got a big problem like most of the developing world. A lot of people don't realize this, but road traffic injuries and injuries in general kill more people every year than HIV, malaria, AIDS, and tuberculosis combined. And this is a very big problem in Malawi, where they're building new roads, and when you build new roads, they're flat, they move, they're smooth, and a lot of people get a little bit of a lead foot. So when the roads improve, so does the number of road traffic fatalities. As you can see from the stats here, that they have almost 3 times as many road traffic fatalities as we do in the United States, and close to 6 times as many as Canada. And in the past year, there was a 35% increase in road traffic fatalities. So as part of this effort, the World Bank had given a loan to the Republic of Malawi to improve their highways. And one of the innovative things that the World Bank is doing is understanding that new roads lead to more road traffic fatalities. They also included in the loan that a portion of that loan had to be earmarked so that they would have to build an emergency medical system. And the partners that were involved in this were the World Bank, the government of Malawi, specifically the Roads Authority, the Ministry of Health, the Malawi Communications Regulatory Authority, which is basically the FCC of Malawi, and also the mobile telecom providers, both landline and mobile phones. One of the interesting things about this, though, is that the lead agency on this was the Roads Authority, not the Ministry of Health. And there's an interesting parallel between what they're doing and what we did here in the United States, because we were in the same situation back in the 60s and 70s. And when we started building our emergency medical systems, they were designed specifically to start out with to deal with road traffic injuries. And to this day in the United States, the lead federal agency is the National Transportation Safety Administration. It is not HHS, it's actually the traffic people. So same thing's going on in Malawi now, and it's really just a result of where the needs are and addressing the problems that are in front of you. So we got to work with all these different partners on this program, and the objectives of the program were to implement what is effectively Malawi's first formal emergency medical system. And what they wanted us to do was to focus on building this system that would be focused on a certain part of the highway, the main principal highway, and that could then be scaled nationally. So the whole point to begin was to start with something where we could do about 220 miles worth of road, and then presuming that would be successful, it had to be built in such a way that it could be scaled nationally. And there are quite a few constraints that we had to deal with that, as Trek Medics, what we're very much involved in and take a lot of care in dealing with, were all prevalent here in Malawi, and they were, to begin with, that it was covering just a highway, right? So there's the M1 highway, which is the principal highway going through the middle of the country. And it had to go across 6 different districts, right? So their districts operate very much like the states do in the United States, where every state, or every district for that matter, is very particular and very protective about their rights and who tells them what to do and who they're going to listen to. So we had to definitely keep in mind that we had to build something that everybody was going to buy into and get involved with, and that we kind of avoided any kind of district against district competition, so to speak. The other thing is that it was focused primarily on road traffic injuries. And this was something that, while it was earmarked, okay, we've got to build a system that's going to be focused on road traffic injuries, everybody knew that, you implement an emergency response system and you say, oh, only call this in case of emergency for road traffic injuries. The people weren't going to listen, right? You knew that if there was another emergency, a woman went into childbirth or there was a sick child, that they were going to be calling that system as well. So we had to really work on the messaging and how that was communicated to the public, but also keep in mind that, the primary source of the funding and therefore the primary training that was going on for this was for road traffic injuries. So it was kind of this gray area that we had to really be attuned to. The other issue was that there are multiple languages spoken. English is an official language of Malawi, but it is not the only one. And so we had to really make sure that when we were setting up the call center, that we were working with dispatchers that could speak whatever the languages that were being called in for were, but also that this would be reflected in the software that we were implementing. Another big problem was that normally when you think about emergency medical systems or any kind of emergency response organization or system, you think about radios. The issue in Malawi was that they didn't have the radio networks that we do. In the two main cities that were at the northern and southern end of this system, yeah, they had radio networks there, but in between, in the rural areas, there was no radio networks at all. So we knew from the beginning this was going to be a mobile-only system. It would have to be able to take calls from landlines as well, but there weren't all that many landlines to begin with, so it was primarily mobile-based, but all communications with the responders had to be mobile phones only. We also had to make sure that all telecoms participated and that anybody calling from any phone would be connected to the call center. And the other big thing that really, is something that we're always keen to is that they didn't have any real institutional experience working with emergency medical systems, right? There wasn't a legacy of emergency managers who were there and, were ready to implement or to involve all of their learning experience. In fact, we were working with a lot of people who just had no experience doing this before. So we had to make sure that we kept that in mind. So here's a map of how it worked, the design. The catchment area was going from there in the top left is the capital of Lilongwe, and in the bottom right is Blantyre, the other big city in the south. And this was a 225-mile stretch of highway. And the way it was set up was that along the way there were 10 ambulances parked or stationed, I should say, at health clinics and hospitals along this road. But then in between them, the whole point was to make sure that we could get response times very, very low, get people on scene quick. And given the length, that was a little difficult to do with only 10 ambulances. So we had 500 community responders who all had feature phones. Some of them had smartphones, but most had feature phones. And they would be they would receive text message alerts while the ambulance was en route. So they could get on scene very quickly and determine if the patient needed to go to the hospital. If so, then the ambulance could continue en route. But if not, they could cancel the ambulance long before it got there. And that would really work to keep the wear and tear down on the ambulances and to save money and fuel and all the other issues that happen when you rely only on ambulances and send them all over the place. So this is the map of how it looked. And I'm going to pass it on to Yang here to talk a little bit about the call center.
Sure. Thank you, Jason. So the timing of Malawi's interest in this program and the general availability of Flex last fall gave us a very unique opportunity, almost like in history, to bring an emergency services system to Malawi. Truck medics for many years in developing countries have been using their beacon system to communicate with and organize emergency responders. The beacon system itself, which has been around for a number of years, is itself basically an emergency response workflow platform that up until Flex came out relied primarily on Twilio's SMS and push notifications via their mobile app. Now with Flex, we have a contact center platform that allows us to easily embed workflow applications like Beacon to give users a single pane of glass view into the system, as well as allow us to leverage the full suite of Twilio APIs, including for voice. Both Flex and Beacon are cloud-based, and so they are inherently scalable and relatively easy to deploy. We were able to implement the framework in Malawi in a fraction of the effort, time, and cost compared to the traditional way of setting up a contact center. Now, of course, all this wonderful technology is of limited value if people don't or can't use it. And so to facilitate ease of use, Jason met with Malawi's government to designate 118 as the emergency number to dial for road accidents. And a related consideration to this is the fact that many people in Malawi, like in a lot of developing countries, have bypassed landlines and gone straight to mobile phone adoption. And so we needed to meet with Malawi's mobile carriers to get them on board the program and discuss with them an implementation plan from a technical standpoint. So today, when someone dials 118 on the M1 highway in Malawi, the call is forwarded to a regular number managed by MTL, one of the carriers, and they pass that call along to a Twilio US number that we manage, and we can process the call using Twilio APIs. We then route the call back to Malawi via the Flex interface that the dispatcher uses. And so this is all very seamless from the perspective of the caller who, upon dialing 118, immediately hears the auto attendant menu that we programmed into Flex and then is speaking with the dispatcher. The dispatcher from that point gathers information about the accident and creates an incident in the Beacon system through Flex. Beacon from that point on largely automates the communication needed to coordinate the emergency response. So this high degree of automation helps to ensure accuracy as well as streamline the training needed for dispatchers. And so today there are approximately 20 people working in the Lilongwe Dispatch Center in Malawi, and they're up and running and pretty much actively taking calls.
Yeah, so thank you. I'd like to rewind a little bit about this to give some context. So last year we were here at Signal, and I was about 2 weeks from leaving to go to Malawi. And the contract that we had with Malawi to set this up was that we would assist them in setting up the emergency call center. And there were two parts to this, right? So all emergency communications includes two parts, and that is the first part is call intake. How does the public call for help, right? And the second part is dispatch. What do you do after you get that call? And so we have Beacon, this platform that we've developed for dispatching. And I've purposely avoided getting involved in call intake because it's quite complicated. And so last year when we were at Signal, I was walking around just thinking to myself, well, you know, we've got to advise Malawi on what they should do for call intake. And my thinking at that time was, we're going to gather around all the telecom companies and we're going to ask them, what kind of solutions do you have? And whatever they were able to do, we would find the best solution and we would implement that. And so I was walking around the booths, and Jim Schweitzer with Vision Point Systems too, he was standing there at the booth, and I said, so I'm hearing about this Flex thing, you know, what do you know about it? Can you share a little more? And he said, well, we've got a demo right here. And so I said, great, show it to me. And he walked me through the demo, and I said, it was almost like Twilio built this for us. I was like, this is just perfect. I mean, there's that, on the left side, you see, you know, where all the calls come in, but then 2/3 of the screen is blank, this gray area where Beacon is just perfect, you know, fit in so well and give us the space we need. And so, you know, I said to Jim, I was like, this is it, here we go, you know, let's talk about this. And I went to Malawi a couple weeks later and I said, well, we've got solutions for you. We've got solutions for both call intake and call dispatch. But we're going to need cooperation and collaboration from all the telecoms. So we knew that if we could get them on board, that would take care of our problems and we would be able to offer them something, especially because it was mobile-based. We would offer them something that, quite frankly, would be, you know, the tip of the spear in terms of developing emergency call centers in resource-limited settings, especially where they had not existed before. So, as Young was mentioned, now that we have 20 dispatchers who are trained working in the call center, and the way that they prioritize calls is through a very simple system of red, yellow, and green. So red is high priority, If that comes in, they're sending an ambulance, lights and sirens, can go against traffic, do what you expect ambulances to do, and the responders are gonna get there quickly as well, the community responders. Code yellow is they're sending an ambulance, they're sending the community responders, but the ambulance is going with flow of traffic, right? A lot of people don't realize, but ambulances running with their lights and sirens, going against traffic, running red lights, actually causes a lot of accidents and fatalities. So we don't want to be putting anybody, the public or the responders, in danger. So code yellow, go with the flow of traffic, get there when you can. The responders will be on scene ahead of you. And then code green is simply, we're not sending an ambulance. We'll send some responders to check it out. But from what we're gathering, the information we're gathering, this is going to be either self-transport or, go home and just hope things get better. Low acuity problems. So we were actually able to set this up in Flex so that for those low acuity problems, those code green patients, if needed, if the call volume was high and the dispatchers were occupied, you could put them kind of in a parking lot when other calls were coming in so they could make sure that they weren't keeping any code red calls or even code yellow on hold. And so this worked very well, and again, VPS helped us in a matter of minutes to set it up so we could have these queues. And the amount of time that we spent on this training between Beacon Flex and all of the other training that we had to do to teach them about being a dispatcher was largely, I would say about 20% of our time was spent teaching them about the technology. And of that, most of it was for teaching them how to use Beacon. They got Flex really quickly, understood it, very intuitive, and we just didn't have to spend a lot of time on that. So the majority of the time that we spent was teaching them how to be dispatchers, how to take calls, how to manage the callers, how to prioritize, get the information they need. And frankly, we spent a lot of time teaching them about how to use like Google Maps and typing, because computer proficiency in Malawi is quite low. So again, we couldn't be more pleased with how Flex was working out for this. To give you a little more context about how this looks, you can see here on the left side of the slide there is the actual workflow that we used for Flex. And pretty standard, straightforward, and does exactly what we needed to do for handling emergency calls. In the middle is how the setup actually looks with Flex on the left and Beacon on the right. And then we used, on the bottom is the actual workflow for responders. So when an incident is created through Beacon, the responders walk through those 6 steps, up to 6 steps. Sometimes it's shorter, but at the most 6 steps, that's how it looks on SMS, and we were using Twilio's programmable SMS to start that off. We eventually switched to a local VPN using an SMPP connection to do SMS, but that took a while, and it was fantastic that we could use Twilio's programmable SMS to get that started, so we didn't have to delay training in the meantime. And then also for push notifications, the ambulances all have smartphones that are deadbolted to the ambulance dashboard, and they're using the Beacon app, and that's all done through Notify. And I'm going to show you right here a little demo just so you can see how it looks. If you can, we're good? Okay, so here's just a quick run through. So you can see on the left, that's a call coming in. Dispatcher answers it, starts talking to the patient or the caller, gets the information, and then starts adding it in here. And this is just a demo, so they weren't really dealing with Ebola in Malawi, though the DRC is not far away, and that's certainly becoming an issue. But as you can see, the incident is created by the information is put in by the dispatcher, and then they send that out through Beacon, and then we're able to monitor the responders right there through the interface. So once we've taken the call in, put the information into Beacon that the caller gives us, and then sent it out as an alert, it's largely automated after that. And this is one of the things that we have been trying to do since the beginning with Beacon is if you go to a 911 call center today and you listen to the dispatchers, you hear a lot of redundant communications, right? Are you there? Are you going? Do you need more help? Are you going to the hospital? Are you at the hospital? Asking the same questions over and over to the, the units. And this is all just legacy stuff that we've had to do because we've been in largely radio-based communication systems. But now that we're in the mobile age, you know, the whole point is let's eliminate the redundant radio chatter, let's automate what we can, and make sure that the radios, when they exist, can stay open for actual important communications that fall outside of the regular workflow. And that's really what we've been striving to do with Beacon. And in an opportunity like in Malawi, just works very well for making sure that everybody's being tracked and without interruptions that are unnecessary. So there were definitely some challenges. One of the big challenges that we faced right away is, again, Malawi had no emergency call center like this before the project started. And so when we came in saying, you know, this is what we're going to do, they were kind of wondering, where are the phone banks? You know, where's all the hardware? And we're like, oh no, you just need a laptop and an internet connection. And it was kind of like a little suspicious about, you know, do these guys know what they're doing? You know, what they're used to, quite honestly, is if you've never done something like this before, the idea that people have in their minds is kind of like a NASA command central communications hub where everybody's got, like, you know, screens and headsets and running around. And so we come in and we're like, oh yeah, just a computer, you know, a couple computers and an internet connection. It was like a little hesitation, a little reluctant suspicion about us. But once we gave them a demo, then I was like, okay, all right, we feel much more comfortable, you know, we're getting our money's worth, so to speak. Another big issue was the telecom participation. I don't think there's anybody in this room, you know, who would be surprised to learn that we had a little work to do with the telecoms to get them all on board, right? To get them all working together. And one, it was the collaboration between the telecoms and the government. There was also collaboration between the telecoms and the other telecoms. And then there was also the issue of the SIP forwarding. Originally, as Yang mentioned, we were trying to do forwarding to a SIP domain. Well, we got down the road when we finally were told that they couldn't do that. So we had to instead do forwarding to a US-based phone number. So there was a definite learning process going on there. The other big issue that, I mean, really took me by surprise was the cost of internet. When we got there, we said, okay, we're gonna need a high-speed internet connection, you know, let's say a minimum of 100 megabits per second. And they all looked at us like, 100 megabits per second. And we're like, well, what's the problem? 100, you know, I'm thinking I'm in New York in my apartment, I'm getting 250 megabits per second, $70 a month. This can't be that hard, you know? And then we started talking to the internet providers, and we were finding out that the cost for internet in Malawi is $200 to $400 per megabit per second per month. So when I come in saying 100 megabits per second, they're like $20,000 to $40,000 a month, you say, huh? And it's like, for that much, we could buy an internet provider company, I think, you know, and just do it ourselves. So we had to do a lot of testing to find out, okay, what is the bare minimum we need to run Flex and Beacon and make sure that we can take calls in? And the answer that we came to was about 4 or 5 megabits per second is what we needed. But still, the price, it was just, wow, this really, didn't see that one coming. So lesson learned. And then the other one was the SMS gateways. That was certainly, makes us appreciate Twilio all the more because we can set up a new SMS gateway in seconds. And having to set up the VPN and then the SMPP connection as opposed to HTTP SMS, you know, it was, that was a learning experience too, but we were eventually able to set it up, and now we're sending out SMS messages with local Malawian phone numbers. So finally, outcomes. Today, they have their very first national emergency call center, 118. Thank you. Thank you, Jacob. You can call from anywhere in the country to 118 and they're going to connect you. Of course, this call center, you know, the coverage area is only along the highway and a 5-kilometer border on both sides of the highway, or a buffer, I should say. But you can call anywhere from anywhere in the country and be connected to 118. So we definitely succeeded in making sure that we had a scalable system ready for them. as I mentioned, the dispatcher training, because of the ease of use of Flex, and I'd like to think because of Beacon, we could spend very little time actually having to teach them how to use the technology itself, and rather focus on all the important things that come with being a dispatcher. Notably, how to manage calls and talk to people who are in very high stress situations. The other issue that the outcome was that we had to really put into effect, and they're still working on this, the public messaging campaign in how do you communicate to people what this number is for and what is an emergency and what isn't. And this is a complicated thing in any country where your definition of an emergency is going to be different than somebody else's. But one of the things that happened off the bat was that they were getting between 400 and 600 calls a day, and most of them were from people who were just calling to see if this actually worked, like call 118 and you're going to send me an ambulance, let's see about that, and they get on the phone and they call 118 just to see who answers. But the other big outcome of this, and that we're really proud about and very much thankful to Flex about, is what we say in emergency communications, a big concern is backups, right? What happens if the power goes out, which in Malawi it does, or what happens if the internet isn't working. And the beauty of this is that what we say is all you need is a link and a login. And what we explained to them was, let's say the power in the call center goes out. Well, if you're able to contact somebody at home, the manager is at home and he's got a computer with an internet connection, they can open up their laptop and start taking calls as if their kitchen table were the 118 call center right then and there. So the idea of backup systems, because of Flex, it's just completely changed the way we're thinking about backups. All you need, again, is a link and a login. So there it is. I said it. It really is going to solve everything for us when it comes to setting up emergency communication systems. Thank you very much for your time. If there are any questions, it looks like we have a couple minutes. I'd be happy to take those. Sir.
I'm curious why you went from Twilio SMS to the SMTP-based one.
Okay, so the question is,
Oh, sorry. Okay.
the question is, why did we go from Twilio SMS to the SMPP? Honestly, I wish we didn't have to. The issue was because Twilio doesn't have numbers in Malawi. So the issue is we had no problem sending messages from our US, or actually we were using, I think, a Swiss number. We didn't have any problem sending messages to them, but nobody was going to reply to those because they had to send messages internationally, which, 3 to 4 cents a message, quite a bit. So that's why we had to stick with the local Malawian number. Yes, ma'am. Good question. So did we have any interface with other NGOs or, in the country? While we were there, Cyclone Idai happened, if anybody was paying attention, aware of this, which was a cyclone that wreaked havoc in Mozambique, but also in Malawi and even into Zimbabwe. And we were sitting there kind of like chomping at the bit. We know we can do something about this. But because we were working, we were guests of the government and we were working, we just kind of had to, bite our lip and say, okay, once it's implemented. And the other thing, we actually did talk to a couple NGOs, but one of them in particular was Partners in Health. And we said, and they were involved in the response. And we said, we've got this thing that's setting up. Would it be of use to you? And they said, yes, this would be of use to you, but you guys are working with the government right now. Let's wait until that. Nobody wants to get in the way and upset the government and seem like they're going rogue. So unfortunately, we weren't able to do anything then, but certainly this call center is set up in such a way that they could scale and include responders from other NGOs quite easily. Sir?
I'm just curious to hear about the next steps on what you're hoping to achieve in the area.
Okay, so in Malawi, really, that's up to the government, right? The World Bank loan certainly made it possible, left the door open to expanding this nationally, and I think that that's definitely their goal, but that's really within the hands of the government. If I may take the opportunity, from our perspective, Trek Medics, our experience with Flex has been so positive. And working with VPS on this, we're actually, in 2 weeks, I'm going to be going down to Haiti, where we're implementing a program with the University of Florida for a National Institutes of Health funded project to do a call center for, again, focused on pediatric emergencies after hours. But this program, if successful, will scale and has a lot of opportunity. And then also in the United States, we're actually starting to get involved. We've just got a grant. We're going to be getting involved in the opiate epidemic, where there's a big problem with overdoses, obviously, but we've got this naloxone drug, which is now being handed out and is quite liberally. And the problem still is that naloxone saves lives, but the only way that you can get naloxone, if you need it, by calling, is to call 911. And that's obviously a problem for a lot of people who, don't want to call 911 because of illicit drug use or because of the stigma. So what we're going to be doing is working with communities to set up overdose response networks where you can basically call a number to report an overdose, and the dispatcher will use our software beacon to send out messages to community members who are carrying naloxone. They can respond quickly, reverse the overdose, and save a life.
And if I may, what we've done in Malawi is a template that can be applied to a lot of other developing nations. And the irony is that, well, I mean, obviously Flex is more or less invented here, but if you look at our 911 system, compared to that, what we're doing with Flex is actually like leading edge at this point in time, whereas our 911 system, the infrastructure was built out decades ago. And so we're actually applying more sophisticated technologies in developing countries.
Yeah. Absolutely. In terms of call centers and emergency communications, the legacy systems we have in the United States are very much bogged down by the legacy technologies that they have, and Flex just offers such a huge step forward in that, and we're really excited to see where it goes. So it looks like we're out of time, but if anybody else would like to talk more, we'll be here. Thank you very much for your time, and enjoy the rest of your conference.
Thank you.
Thank you.